Overactive bladder has a number of treatment options, that being conservative therapies and then our surgical therapies. And really on our surgical therapies, there's two treatments that we frequently do. One is Botox injections for the bladder and the other is Interstim therapy. And there's pros and cons of both. For Botox, the great thing is it's just done in the office. It takes about 5 minutes to do. And patients do not have to prepare for anything beforehand and are able to drive themselves into the office and then leave right afterwards. Some of the things we worry about with Botox is that there is a chance of getting a bladder infection, so we will give patients antibiotics right after the procedure to prevent it. And the other thing we worry about is urinary retention, not being able to empty your bladder afterwards. That rate's pretty low, it's around 5%, and we usually start with the lowest dose, so it probably brings that risk down even lower. Interstim therapy is interesting because it's one of our truly reversible therapies. So we can test a patient to see if it's going to help them before we actually operate on them and put the unit in. So you can do a 1-week test, which can actually just be done in the office, and then they go home with this little lead or electrode that's just taped to them that they wear for a week to see if the therapy helps them. Another option is a 2-week test, where in the operating room we put the permanent lead in and then test them for 2 weeks. During all those testing phases, we're interacting with the patient, trying to decide if it's the right therapy for them. Botox will last anywhere from 6 months to a year before you need repeat injections. Interstim therapy, the battery life is from about 3 years to 5 years. They're both great options. You don't have to do one before the other, and certainly you should discuss with your provider which one's the best one for you.